So first we want to set like, the situations where it would be acceptable. Then once they understand like it has a real role and there's real value and there's utility, then we want to show them like, okay, now if you're going to do this, we want you to do it safely. So we have phantoms where we put in, let's say, like a Tupperware tray or like any sterno tray where you have your hot meals, and we put a gelatin agar, and within that agar, which is like, it's like Jello, right?
Mm.
We put little pieces of maybe chicken breast, or sometimes we put an olive or different sort of food in there, even a cherry one time. And so what you do is with ultrasound, because you can make it opaque or you can leave it transparent, but ultrasound allows you to image that. And then you can see your needle tracking toward the target. And then once you have your needle appropriately located, then you can go ahead and turn on the RFA machine and deliver the energy and see on the ultrasound what the tissue does. So the characteristic changes. Practice the moving shot technique where you're bringing the needle away from the areas that you're treating so that you're not leaving it there for too long to heat up anything that you don't want to heat up.
Mm-hmm.
And then they get to see how the tissue works, the treatment works and how the tissue is treated. So that's very encouraging. And then the last thing we do is, which is not entirely representative, of course, of the real live situation and the turgor of the tissues and the challenges that an awake patient provides or a live patient provides,
Mm-hmm.
is that we use a cadaver, very thankfully, for medical research, where we are going to go ahead and use the ultrasound, do the lidocaine injection to get some anesthesia, do a hydrodissection to dissect around the thyroid capsule, push the carotid sheath away, for example, practice those techniques, and then we treat the thyroid or adjacent lymph nodes with the radiofrequency. So they get a good idea of how that works on that exact tissue. I can tell you that a lot of the participants are very encouraged. They're very happy. They're like, I can do this. So it's really neat to see this kind of enthusiasm, a real-time learning, and I think they go back encouraged to go ahead and do it. I'm not sure that everybody goes and says, oh, I'm ready to do it. I think that they're probably about 50% of the the participants go ahead and actually start their own RFA program.